Thank you for joining us. I'm Jared Linder. This is David Baker. We are ICURNs. We are with the diabetesrevolution.com. We started this as a way to educate people because we got tired of seeing people suffer because they didn't have simple information. So we're here to provide that.
Yep, seen it over and over again. All right, so what we're going over is the three things you can do right now to prevent heart attack or stroke, and what is cardiovascular disease and how it destroys every organ in your body, and what are the three things you can do right now to stop the destruction and avoid heart attack, stroke, and different things like that. So our mantra kind of today is like, you don't know what you don't know. So how do you want to start this story out here, Jared?
Well, yeah, you don't know what you don't know. So, even if you're super smart, if you have the wrong information or you have a lack of information, you're in danger. So that goes back to, I seen a patient a while back. I walk into his room, to chat him up, and Bobby the engineer. Bobby is so smart, and that's not his real name, but Bobby is so smart. He's an engineer. He's like one of the top people in his field. Highly intelligent guy. Hadn't been to the doctor since he was a teenager. Now he's in his 50s. He just finds out, his chest was hurting a little bit, so he come to the ER. Next thing he knows, he's diagnosed he's diabetic. Had no idea that he was diabetic. So, when I walk into his room, one of the first things he's concerned about is, am I going to lose my legs? I know people that have lost their legs because they couldn't afford insulin. That was kind of his thing. And then, so that was his big deal. He was concerned about losing his legs. I go back into his room to talk to him a couple hours later after he got back from heart cath, and now he's learned that not only may he lose his legs in a few years, but in a couple days, he's going to go have open heart surgery because he has major cardiovascular disease, which was brought on by the diabetes. So now he gets to have his chest cracked in a couple days because he didn't have that simple information.
Right. So you go from one little thing, not ever going to the doctor, to straight up open heart surgery. And that doesn't happen overnight. And one of the things we're hitting here at the Diabetes Revolution is we're talking about education on the diabetes and all that things in general. And so when the doctor came in there and said, hey, you're having open heart surgery, they're supposed to go through all the pros and cons and risks and benefits. And how long was the physician in there for?
Yeah, less than 5 minutes. Probably much less than 5 minutes, but in and out. You have a question? If you do, let us know.
And I'm not dogging the doctor here, but this happens all the time because it's a routine thing for the doctor and nurses. He probably does, I don't know how many surgeries a day. So they're totally overloaded on patients. So it's the system in a whole. It's a routine thing for us, not a routine thing for the patient. And so they just run through stuff really fast like that. And same thing, day after day after day, it becomes routine, not routine for the patient. And the same thing with diabetes education. So people will run through, hey, you got diabetes, quick things from the actual staff nurse, and then you have the diabetes education. And the doctor, I don't know how many times they don't come in at all, or they spend like just a few minutes. Hey, we're going to put you on medication. So it's really lacking the hospital system, and that's what we're doing. So now we're going to go over what's cardiovascular disease and how does diabetes affect it.
Okay, so cardiovascular disease, put in simple terms, it's a disease of the hoses in your body. You have hoses or pipes in your body all throughout your body that feed your body and keep it alive. They feed every organ in the body. And what diabetes does is your blood sugar is too high. So when it's high, that sugar is hanging out in the bloodstream, in the blood vessels, not meant to be there. And it rots those hoses. I mean, it just breaks them down and rots them and causes them to get hard and get damaged and clog up. And so over time, that just affects every hose in your body. So where do you have hoses? Well, one of the biggest ones is your brain. And so that's where you get the debilitating strokes. The person didn't even know they had diabetes, had no idea they had a problem. Next thing they know, they can't move the right side of their body. They're in a wheelchair for the rest of their life, maybe living in a nursing home. It causes people to go blind because we have hoses and vessels that go to our eyeballs and help us to see. Those hoses get clogged up, get damaged, and you lose your eyesight. Diabetics, they can lose their teeth. Gum disease is a big one because you have lots of blood vessels going to your gums. And then like Bobby, his heart, he's having major open heart surgery where they're going to have to bypass the major vessels in his heart because they're damaged. Um, another big one that we've seen a lot is dialysis. All these dialysis patients because their kidneys have failed because those hoses are messed up.
All the
Um,
time. Kidney disease, that's the number one thing with diabetics.
and tell us a little bit about what it's like to be on dialysis, David. I mean, we've seen a lot of people like that.
Yeah, you're going to go usually Monday, Wednesday, Friday, or 3 days a week, 4 hours a day to get your blood cleansed by a machine, and you can't miss. You miss a day, what happens, Jared?
You're going to come see us, and you're not going to be happy about it. It's not going to be a good time.
You're going to get emergent dialysis probably in the ICU, so that's a common thing. Kidney disease is a big one, and then as you keep going down, it's going to go into your extremities. What, diabetic ulcers, right, Jared?
Yeah, diabetic ulcers, which is going to lead to amputations eventually. That's where people, okay, I lost a toe. Now I've lost the bottom of my leg. Now I lost the top half of my leg above my knee. Now I lost my other leg. I mean, it's common. If uncontrolled diabetes, and it's huge. It's huge.
Yeah, and don't forget, like in the ICU, what's the main thing we get all the time? Sepsis, right? So those wounds that don't heal, they get infected, it gets in your bloodstream, you get sepsis, and mortality goes up 7% every hour you don't get diabetic or get antibiotics for that infection. So yeah, bad things happen with that.
And it's a horrible way to die. I mean, it's a horrible way to live. Yeah. It's a horrible way to die, and it's avoidable, and that's why we're here.
And not only that, I mean, your quality of life on all these things that's affecting. Your heart goes bad, you're going to be out of breath. You can't climb up the stairs to go watch your kid play soccer, right? Or your grandkids. Because your heart's not pumping, you're going to be out of breath. You got the kidney thing. What are you going to do? Watch daytime television like for 4 hours a day? How miserable is that? And then just like you said, stroke. I think that'd be the worst. Impaired the rest of your life.
Yeah. Somebody else has to feed you.
Yeah. So we're going to go
other bodily functions for you.
But, exactly. So we're going to go over the three things you can do right now to not be in Bobby's situation. And Bobby was a smart guy. We don't want you to go undergo heart surgery like this guy. We don't want you to go to dialysis. We don't want you to have all these issues. So the first thing you can do is get yearly blood work. So what happens if you get yearly blood work? It's cheap, right? If you get this, it gives you a baseline where you're at. And it tells whether you got improvement or decline from your baseline of diabetes, right? So you get something, hey, this isn't right. You can check it again in 3 months to see if you've improved or declined, depending on what it is. Hey, if it's your kidney function, oh, something's messing with my kidneys. Oh, if it's your glucose, something's messing with your glucose. There's multiple things, and we do that every day in the hospital, right? Every 4 a.m., they're going to draw your blood, and we're going to check it and trend it every day. Are they improving or getting worse? So you think Bobby would have figured something out if he had some blood work done?
Yeah, I mean, he would have known a long time ago because, he probably started in his 40s starting to notice these symptoms that he told me about, but he just thought it was part of getting older. 40s is real. So, when he started having to get up 3 or 4 times at night to use the restroom, he just figured that was part of getting older. So the increased urination, which is a sign of high blood sugar, he didn't notice that. He just kind of blew it off as getting older. Recently, the past year or so, he's having more and more shortness of breath. So he just stopped taking the stairs. He stopped going to the gym. He stopped doing those things because he was short of breath all the time. Then he started gaining a little bit of weight. He noticed he was hungry all the time. No matter how much he ate, he wanted more. And, he just felt like it was because he was undisciplined, like he was didn't have, had a food addiction or something. He didn't realize that it was because his insulin levels were high. His body wasn't getting the fuel it actually needed. That's why he was constantly starving, no matter how much he ate. So, but he just ignored those symptoms as part of getting older, part of being undisciplined. He blamed it on himself, not knowing. Another big one that he kind of ignored and blew off was he figured it was because he sat around at his desk all day as an engineer. Was the prickling in his toes and the tingling in his toes. Another sign of prolonged high blood sugar. These aren't symptoms that just pop up overnight. This has been going on for years for him.
Right. So that goes to number 2 thing you do. So the first, get some blood work. Number 2 is listen to your body, okay? Your body tells you when things are wrong. You have pain somewhere, it's telling you, hey, something's wrong. You know, I mean, that's a natural body reaction. So, and the nose thing that the diabetes is with that neuropathy and that tingling. I mean, I've known a guy, that an old farmer, he had neuropathy. He had a pop bottle lid in his shoe. He could not feel that. And he walked around all day with that pop bottle in his shoe, chewed the whole bottom of his foot up, didn't even know it. And so some of the times you get so used to this stuff, like tingling sensation or numbness, it can cause major damage and you don't get that feedback. But you know, with Bobby, he's getting short of breath. That's his heart telling you, hey, something's wrong here. Get it checked out. Hey, I'm peeing all the time. Well, I'm getting older. Yeah, that can be a sign, but it's also a sign of other things. So you need to get these things checked out. So listen to your body, get your yearly blood work, get it every 3 months. I mean, you get new blood cells. So you need to go get that checked every 3 months if you're having issues, to not only get your baseline, but then to see if you're getting better or worse. And then the third thing, you got the blood work if it's bad, or if it's not, if it's a little bit elevated. If you're having signs and symptoms like what we were talking about, go see your doctor. Say, okay, so you want to go see your doctor, but you also want to do your own research, okay? Because it's really your responsibility. That doctor's not going to, you go and see your doctor, he's on to the next patient 2 minutes after you're gone. He's got home life, he's got other things going on, and he's not going to put you at the same level you're going to put yourself. And really, you're responsible for your own outcomes and things. So not only do you need to do that, you need to educate yourself, Jared, right?
Absolutely. You know, and regardless of how you get the wrong information, or regardless of how you don't get the right information, you're the one that's going to suffer the consequences. I mean, you know, regardless of where it comes from, if you don't know, or you know the wrong, you're the one that's going to suffer. So if you don't know the right questions to ask, or you don't know enough to say, I'm not sure if what you just said makes complete sense. Can you tell me a little bit more about that? Or can you explain to me why? You know, you need to have a little bit of information in your arsenal so that you can educate yourself, so that you can, you know, interact with your physician or your provider and have an intelligent conversation about your health and your body and the things that you're going to do to take care of yourself.
Yeah, and along with that, you can't fix something if you don't know about it, and that goes back to talking with your physician, like you're talking about. Get your blood work and learning and educating yourself, because you got to know these things. And so read your books, learn about it, and if you need more information about diabetes or need some help, we got a free 7-day program.
Yeah, and they can, because they can go to
That's right.
our website, the diabetesrevolution.com, get their free 7-day starter program for newly diagnosed diabetics.
Yeah,
because you know that's going to help you start the conversation with yourself of how you're going to educate yourself and move forward. Completely free, the diabetesrevolution.com, 7-day starter guide. It'd be crazy not to just go get it. It's
download it. It's just a PDF. That's it. We'll throw it to your inbox.
Free of charge. Our service to you.
Yep. All right. Until next time.
Thank you, guys. Thanks for watching. We'll see you soon.
Yep.
Click on the next video.